I just want to share with you a template that we can use at Dental Health Professionals for recording images via the Prexion CBCT. Now, this is a program called Kuroku that will work with simply a cut and paste into Dentech. But Kuroku has a bunch of templates that are out there that dentists use and oral and maxillofacial radiologists use and other specialists use to make sure our clinical notes are of sufficient quality. So I've got this template right here. I'm going to select, and let me just go ahead and get this all set. So we have what we call a radiography clinical note, and this program lets you use a mixture of drop-down menu items and your ability to enter your notes to create a clinical note that we can essentially cut and paste right into Dentech. But it gives us a structure and makes sure that we're kind of ticking all the boxes appropriately for essentially capturing these images and doing some type of even base level interpretation. Okay, so the first thing we're going to do is we're going to select the doctor of record, and in this case it's going to be me for our example. So I'll select that. It says staff member performing the scan. I'm going to hypothetically put in BB, Becky Brandel, for this one. She's going to be doing the imaging. And then most importantly, the type of scan. So in this drop-down menu, we have 6 options for the types of scans. This matches the current CDT 2022 terminology. So we can take a panoramic image. We can have a limited field of view CBCT. So that'd be something we'd use commonly if we're evaluating endodontically involved teeth or something of that nature, maybe just a portion of the lower jaw, upper jaw, wherever it may be, just looking at a few teeth. Then we can do the full mandible, the full maxilla, a dual arch CBCT, and then the TMJ CBCT. And this encompasses one code would be for multiple images, 2 or more images, so you can image both right and left. These are the only codes right now that would pertain to the Prexion. We don't have the options for any periapicals or anything like that, so that's not what we're going to be using this for. So the majority of the time with endo, we're going to be looking at a limited field of view CBCT. So we're going to select that, and then we have the option of selecting the region of the scan. This is just like what you saw on Dr. Allen's referral form. So we have upper right, upper anterior, upper left, lower right, lower anterior, lower left. And in this hypothetical situation, I'm going to select the lower right. So it will then give me an option to select specific teeth. So you could pick right-hand side, all the lowers, all the uppers, a quadrant, or specific teeth. So we might want to look at tooth 30, but I'm probably going to pick these other teeth around it, one tooth either side. We'll add that note right there. The next one is very important. It's the clinical justification for exposure. So for us to have any opportunity for insurances to consider picking up these images, we want to input something that tells them why we're going to do it. So the most common things we have are already pre-canned here. So there's evaluation of third molars, assessment of teeth with potential endodontic pathology, evaluation for implants, and then we have what we call evaluation of potential pathology or anatomical irregularities. Things that would fall under that would be any type of radiographic artifact or something that we picked up we want to take a look at more detailed, or perhaps any areas of periodontal irregularity. We want to take a look at the bone levels around teeth, things of that nature. And of course we have the catch-all other, where you can select that and then just input and type what you want. So in our scenario with endo, we're going to select assessment of teeth with potential endodontic pathology and planning of endodontic treatment, where 2D plane radiography will not provide enough detail to adequately assess the condition of the teeth in question. Clearly that isn't something I came up with on my own, but that's what we are advised to write so that we have an opportunity for coverage of said images. So we're going to select that. I have to enter some clinical impressions. So this would be, in our example, number 30, previous endo with PARL, so periapical radiolucency, associated with distal root apex. And then we might put something else like tooth number 30 has sufficient remaining tooth structure and is periodontally sound. Something like that. Basically just conveying that tooth is good, we can restore this tooth. Peripheral findings, very important. A lot of times when you get these volumes, you're going to find things you weren't looking for, and we have to account for that. So if you find anything, like if I were to pick up something like, retained root tip, I could put that in there. If we don't have anything going on, which hopefully that's the case, you can select this and just put none. So it just is saying that we didn't find anything else. Differential diagnosis, so in this hypothetical, number 30, previously with asymptomatic apical periodontitis. Okay. And then we have the option of saying, do we need a specialist oral and maxillofacial radiologist to review this? And we have options. And I just want to be clear on this. We can input that we advise it or we don't advise it. And the patient can basically accept our decision of advising it. You really don't have to have that if it's not advised. But if we didn't advise that it be read, we do want the patient still to know that they can request it, and that is their option. It's a bit like when we biopsy something where we may say, hey, you don't need to send this in, or you do. If the patient really wants it to be read, then we send it in. So if a patient requests that we send it in, we really want to do that. We want to make notes of that. Probably more importantly is if we advise that it be read and the patient declines it, we can mark both of these. So you can mark as many of these boxes as you want. But in this case, where we're kind of passing this off to our specialist endodontist, we really don't need the oral and maxillofacial radiologist to get involved. So I'm going to click not advised here. Okay. And then copy of image being sent to, sometimes we're going to want to send a copy of that image on. So the most common people we're going to send that on will be to patient, oral surgeon, endodontist, whatever. In this case, I'm going to select Shoreline Endo. I'll add that note. If we weren't going to send it on to anybody, we can actually go over here and select this little X, and it's going to enter, right? It's going to basically remove that there. So once we've got our note set, then I can actually go ahead and hit copy notes, and then I'll jump over to our theoretical Dentec, and then we just go Command V, and it inputs it. So basically, it just takes all the information that we input here and spits it out in our clinical note, and then we can go ahead and move forward that way. So gives us structure, gives us at least a little bit of interpretation. It's repeatable, and it's going to give us an opportunity to justify why we did this, so we could potentially get some insurance reimbursement. So we're doing that for our patients. So take a look. Let me know what you think. I can completely edit these, but we want to keep it short and sweet, and I think this is a very, very good start.